Alrighty, we're going to start off with some general ED questions that were submitted with registration. So first question here tonight is, how does TRT affect erectile dysfunction?
So TRT, or testosterone replacement therapy, is important but not essential for an erection. In other words, men can have low testosterone and still have normal erections. But the way that I look at this is as an optimization. So if you present to a physician that is very well trained in men's health and sexual medicine, and you present with erectile dysfunction, most likely that doctor will check your testosterone levels and monitor it and treat it if it's low. One of the practical advantages to this is if you're somebody that's tuned in now, that tuned in because pills are not working for you anymore, so the sildenafils and Cialises aren't doing the job, you think, well, what's next? One thing to consider is there is a reasonable response rate to those pills if your testosterone levels are normalized. So say you come in, you say, doc, the pills aren't working for me anymore. I'm ready to do injections. I need an implant. And I test your testosterone and it's incredibly low. I say, well, before we do that, I'm delighted to take care of you, but let's find an option that works and let's explore everything. Your testosterone is incredibly low. If I normalize that, if I do some kind of TRT for you, whatever it is, whether it's pills or injections or pellets, we get that T level up. You may find that you're still going to respond to those pills, and maybe you get another year, 2 years, 5 years where you're having excellent intercourse with your own natural erection. So TRT, I think, is a very important part of overall men's health, and balancing those levels can optimize erectile function as well. So I appreciate the question because it shows a good understanding of the interplay. The basic science real quickly is the higher your testosterone levels, the more natural nitric oxide you're able to produce. And it goes back to nitric oxide is cash for an erection. So your higher your cash flow, the better your erection.
Alrighty. Next question here. This person says they're 87 years old and they have a healthy sexual appetite. However, pills don't work and the injections are working somewhat. I guess this person's looking for some, if they're a candidate for an implant or not.
Well, I love that question. Congrats on making it to 87 and still being sexually interested. You're a wonderful demographic. In fact, one of the things we know in longitudinal studies of aging is men that are sexual later on in life tend to even live longer. So you're 87, you got plenty of time left, because if things are working and you're still horny, you're still interested in sex, then yeah, you got a lot of years ahead of you, and I think that's terrific. I'll answer that with a story, is that and actually multiple stories, but I can think of one in particular where a gentleman came to me and when he was 89, and he had been married for 60 odd years, and she passed, unfortunately, when he was about 87, and he mourned and he grieved, and then eventually he found somebody again who, by the time he was in my office about 92, she was about 87 and had a wonderful relationship. They both were sexually interested, but nothing else worked for him at 92. He was incredibly healthy. He's probably 112 at this point and still chugging away. And so he was a perfectly good candidate for a penile prosthesis because he was in great physical shape, heart was good, lungs were good. And again, this is a 30-minute operation or so, and the risk of blood loss or major injury is pretty low with it. So I don't really put age as a cutoff point for whether or not a man will do well with the penile prosthesis. I put on their overall health. I've seen 40-year-old men that are probably less healthy than you are at 87, and I've seen 87-year-old guys that are still running the Boston Marathon. So I think that's the key, is age is relative. What else you got?
Alrighty, sorry about that. I have my mic muted, certainly. Alrighty, next question here. This person says that they're 40 years old with diabetes. The pills also stopped working for them, and the Trimix also isn't too effective. This person's doctor, however, said that they could get an implant in 10 to 15 years. Their question is, could they skip all the other treatments in between the implant and the pills and go right to the implant now?
Well, that's a tricky question. I mean, again, it's hard for me to give out medical advice to specific situations. But again, I will say I have put implants in men with severe diabetes well younger than 40. And once we've exhausted all therapies, we've done everything we can to manage their blood sugars, everything we can to manage their testosterone, whatever else I can do. I don't think it's right to deny somebody 15 years of sexual function before they qualify for what we would consider kind of a reasonable age to put a penile implant in them. I think it sounds as if you're very well informed and you've exhausted the options, and that might be a frustrating 10 or so years to not be able to enjoy suitable intercourse. So no, I think if you're the right candidate, we did everything we could to optimize your health, then a penile implant, again, I would go on the other. It's nice that you bookended these questions, with a younger man and an older man, and both would be candidates. And again, it's not only age that's important here. It's overall health. What have you tried? What are you willing to do? What are you willing to risk to achieve penetrative intercourse again?
Alrighty, next question here, a little bit of a follow-up to the diabetes topic. This person is wondering, are these ED meds that we covered tonight safe for a diabetic?
There really should be no issues with your diabetes and these ED meds. They're safe, but it kind of goes back to what the former or the previous man asked, which is, are they going to be effective? And good glucose control, weight control, if you're overweight and have diabetes, it's all about a holistic picture to do the best we can for you. But no, a lot of men with diabetes do very, very well with oral medication.
Alrighty, perfect. Moving right along, next question here. This person wants to know if it is possible to have a penile implant removed after 6 months if they're not satisfied.
It is possible. It's uncommon, and I would like to explore and unpack why they're not satisfied. And one thing we didn't talk about is the satisfaction rates of these implants are very high, but they're not 100%. And the biggest disappointment with implants is men think that they're going to imagine an implant is going to be bigger than they started from. And some men also are very concerned that they feel that they've lost length after an implant. And for the most part, that doesn't happen, but that perception is real, and it's very important to acknowledge that as a physician. But we've done measurement studies and show that as long as you have an experienced implanter that's willing to size you appropriately, you get the implant as big as you possibly can capacitate. But if you're still not satisfied, or if it's uncomfortable, or another reason that is not disclosed here, removing an implant is not that big of a deal. But it kind of goes back to what we said earlier, that most likely then it'll be very difficult for you to achieve erection suitable for penetration going back to pills and injections. It can happen because when we do a penile implant, we actually don't remove any erectile tissue, but we do sort of push it aside in order to get those cylinders in. And when we push it aside, your body will form what we call a capsule, or a thick fibrous rind around where the implant is. And if you remove the implant, the capsule, you really can't remove that in any real good medical way that you'd be able to restore that natural erection again. That's why you have to be very, very sure that you want this procedure before you go through it. It's not a quick change your mind, put me back to where I was before. That would be probably one of the biggest decisional regrets of men that really need to get excellent counseling from their physician, maybe from talking to other patients that have had it. There are lots of forums where people do this to make a very good informed decision before you're ready to do that procedure.
Alrighty, next question here. How often do these implants need to be replaced?
And that varies. It really, most of the time, men get a good 10 plus years before the mechanical aspects break down. Usually what happens is the tubing can wear out, or the pump mechanism will get a little bit faulty, and often we have to replace it for that reason. But for the most part, they last a long time. I've done replacements on men that have had 30 years of great use with their implant, and then it fails. But for the most part, 10, 15 years is a reasonable expectation before we'd have to do a revision or replacement. Often when we do the revision or replacement, it's a little bit less, I don't want to say it's easier surgery to do, but because you've already had that capsule, if the first implant was placed very nicely, then removing it and putting in new components tends to be a little bit less of an invasive procedure. But it's still surgery. I would never discount that. So again, mechanical failure is the main reason for redoing and removing and replacing an implant. But I want to make sure that we get it right so that you get the best longevity out of that device.
Certainly. Alrighty, next question here. Could you cover a little bit about what sensation would feel like for someone that receives an implant? This person is wondering if they would lose any sensation following the procedure.
These are just absolutely terrific questions. I appreciate all of them because these are great. These come up in my clinic all the time. In general, the way that an implant works is because it's just replacing your erectile tissue with this cylinders, and it stimulates an erection that should expand and make those nerves sensitive again when they're fully expanded with fluid. Then the sensitivity stays pretty good after an implant. But I've had men that have taken a little longer getting used to the feel of the implant and being able to actually achieve orgasm. And it's not from the nerves necessarily, but it's, I think, from the overall experience. The nerves that are most responsible for our orgasms, they tend to run along the top aspect of the penis, what we call the dorsum. And I'll bring in the model again here. And so the nerves, that's perfect. So the nerves run right along the top. This is what we call the neurovascular bundle. The most sensitive part of the penis is right in here. This is what we call the frenulum, or the frenular area in somebody that's been circumcised. And that actually is what we call a spinal cord reflex. So stimulating this place directly, either with intercourse or even with vibration, can trigger an orgasm. Because the incision is here, or sometimes up here, depending on the approach your surgeon decides, they're usually going to avoid those nerves. And so you should not have any altered sensation or numbness after a penile implant. Thanks again.
Alrighty, perfect. So next question here, I like this one as well because it's regarding a different style of implants based off of what we've been covering tonight. So they'd like to know about a malleable implant and what the pros and cons are of that.
So the biggest advantage to a malleable implant, and I don't have one to demonstrate, but essentially it's a silicone or sort of it's not exactly silicone, but it's a somewhat flexible material that has a rigid wire, what we call nitinol, which is just a metal flexible alloy running down the center of it to provide some rigidity and structure. And there's no mechanics to it. It's just a device. We put two in, one for each erectile body. We size it appropriately so that it fills out to the very tip of the penis and goes all the way down deep into the pelvis to anchor it. And it will give you what we call a semi-rigid erection at all times. So usually suitable for penetration. Most of the time, you're going to have to be very, very generous with the lubrication if you're having penetrative intercourse, because the malleable does flex. So you can take somebody with a malleable penis implant and almost bend it in half, not painfully, but just to the point where it doesn't have the same rigidity of a full hydraulic implant. But there's no mechanical issue. It's technically a little bit easier of a surgery to put in, so you have no risk of injury to the abdominal compartments, things like your bladder, blood vessels in the pelvis, even intestines. Those are the sort of things that can go wrong with placing that reservoir, which is a critical part of an inflatable implant. So a malleable implant is even usually a quicker surgery, faster recovery to be able to have intercourse again. But its main limitation is that it's always semi-rigid. So it's a little bit difficult to what I call pass the locker room test. You're always going to have a little bit of a show with it in place. But it's still an implant that a lot of men achieve great intercourse with. It's one of the more common implants internationally in countries that don't have coverage for inflatable penile prostheses. So it's much more common in other countries, and still a very satisfying approach. So I think when you're talking with your surgeon and interviewing them, have them show you a model, have them show you what it looks like, and really go through that demonstration.
Certainly. All righty. Do we have time for one more question here? I'm
good.
All righty. Let's see. So this one right here, I think would be a good wrap-up question for the whole implant talk. If you could just talk a little bit more of a refresher, I guess, on the procedure, I guess, and what it looks like in the office and recovery-wise.
Well, let's walk through a patient journey. So somebody comes into me, we've had a nice conversation about the pros and cons of an implant. Then my pathway is to say, we'll find the time to do this. I do have my men usually go through some preoperative assessments, make sure their heart function is good, their lung function is good, so have a clearance if they're of the right age for that. Make sure that there's not going to be any surprises on the day of their procedure. And if they get cleared from anesthesia, then we meet them. Most of the time I do these in an outpatient surgery setting, so it's not done in a hospital if you're healthy enough for that. And they meet me and we take them back to the operating room. They're comfortable. Most of the time we do this with a general anesthesia, but it's one we call a laryngeal mask airway. So you'll be breathing on your own, but you'll be asleep. You will have no sensation. And some men request or would like or prefer a spinal anesthetic where they actually can be awake but have no sensation. So as long as they can tolerate my music and me talking with them during the case, then I'm fine with the spinal anesthetic as well. And once they're comfortable, then we prep the area, which takes a while. Again, this is all part of the what can we do to make that infection rate as close to zero as possible. So I go through a pretty extensive surgical prep, and that can take 5+ minutes. And then we're ready to make the incision. And from the time I make the incision to the time I put in that last stitch, it's usually, again, somewhere between 30 and 40 minutes, depending on patient's anatomy and if I had to do anything a little bit different, if I ran into anything I'm not expecting. And they go to the recovery room, and a lot of them will do what we call a 23-hour observation or stay so that they're monitored for any postoperative issues, and they go home the next morning, usually very early. And you go home and you basically have ice packs for a day or two over the incision to keep your swelling down. I don't want you doing too much activity other than walking. Most of the time, you will be in a state of partial erection, and that allows you to start forming a healthy capsule around a partially inflated implant, but you should still be able to urinate normally, so not needing a catheter or anything like that after the surgery. And then in 2 weeks, you come meet with the team, and they'll take a look at you and make sure that things are looking good and you're healing well. And if I put stitches in you for some of the reasons we mentioned earlier, that's when we'll take those stitches out. And you go home, and sometimes we'll let the fluid out at that visit to kind of give you a little relief, because it may be a little uncomfortable to be partially inflated, but again, it's worth it for your overall outcome. And then depending on how things look at that visit, you'll come back in a week or two, and we start teaching you how to activate and deactivate the implant. And so that's 3 to 4 weeks. And then after that, everybody is sort of on their own in terms of figuring out if they're having issues with it or not. In my practice, I let every patient know it's an open door. So I never want them to be frustrated, or if they're having issues troubleshooting, then we'll set up another follow-up visit, either a video call. When I do these implants with Boston Scientific, they have a great patient assistant portal that can help troubleshoot some simple things and be able to take care of you if you have any questions about the device or the mechanics of it. And for the most part, men are very comfortable engaging in intimate intercourse between that 4 weeks or 1 month to 2 to 3 month period before they're really, really used to it.
And if you'd like to learn more or have your question answered if it was not answered tonight, you do have a few options. So there are more resources in the Resource Center on menmd.com. You can visit this page to view instructional videos, guides, expert articles, and more. If you have a question and you'd like it to be answered by MenMD, you can call MenMD at 857-233-5837 or log into the secure MenMD portal to schedule an appointment with a personal health assistant. If you heard about an ED treatment that you'd like to compare tonight with another ED treatment, you can do so by going to menmd.com and comparing up to any 3 ED treatments that you see on our erectile dysfunction page. And finally, if you'd like to learn more about penile implants or find a penile surgeon in your area or more about insurance coverage, you can do so by visiting edcure.org.
If you found this video helpful and want to stay in the loop with our growing men's health community, be sure to subscribe to our channel and click the bell to be notified when new content is available. Your support makes it easier for other men like you to find these helpful resources. Thanks again for watching. We hope to see you again.